So, speaking of friends and family, clearly going on oxygen therapy usually entails a pretty significant change in one's lifestyle. Are there support groups available, either online or in person, to help people and their families and their caregivers understand a little bit more and kind of get through this process and get used to living well with oxygen?
Yes, I think that's actually an area we've done very well in, and of course we always want to get the word out even more. So there are multiple options for support, and you are exactly right. This is critical. This is oxygen therapy is a burdensome treatment, and it affects the whole family, not just the patient. So there are virtual support groups. The Pulmonary Fibrosis Foundation, you can sign on and it will find a support group near me. ATS has a list of resources. American Lung Association has the Better Breathers. COPD Foundation, Lamb Foundation. Many of these foundations have online lists of support and how you can find it. Our support group hasn't come back in person quite yet, but some have. So for now, many are on Zoom, and actually it's kind of increased access. We have patients that couldn't normally physically come to a support group that can join us. And for those who don't have a computer, there are now phone-in support groups. There are support groups in Spanish for Spanish-speaking patients. And you mentioned the caregiver. There is an increasing awareness for the needs of caregivers. I was just at the American Thoracic Society meeting, and there were some presentations on how to best meet the needs. Not everybody sees themselves labeled as a caregiver, and yet they are a carer of some sort, and assessing their needs specifically. How are they doing? Some support groups have separate meetings for caregivers so they can feel more comfortable in a group of just caregivers to gain support from each other. So it is becoming a very heightened, there's more awareness about the needs of caregivers. So I would encourage family and friends to also contact these support groups and ask for any caregiver resources that they can provide them, because it is out there. I think we are getting much better at recognizing that the whole family is involved.